Wonderful. Thank you so much for that, Lindsay. Well, welcome everyone. Happy Friday. We are so glad that you are here. I am Naomi Williams. I am coming to you from Augusta, Georgia. So excited for you to be with us today. And that is my co-presenter, Noah Williams, who is joining us as well. We are recording, so we can add this to our YouTube channel, as well as live script is available. You can hit the CC where you can see the live transcript as well. Do want to say, I did say I am Naomi. I am a Black female. My hair is in twists. I am wearing a plaid shirt and a green puffer jacket, just in the event if there are those that are joining us who are unable to see me at the present. PFCC Partners, you can see our mission, vision, and values here. So this is what we are all about. We want to see a health system transformed into one that works with people and through communities as a partner in their well-being. We catalyze system improvements by centering that human experience of health. And we absolutely recognize the critical role community engagement must play for every effort at delivering health equity. So thinking about it, we have healthcare. Many of us know that healthcare is a very complex system. You've gone to the doctor, you know this. Calling the doctor, you probably have experienced this. There are millions of people, there are hundreds of agencies and organizations, there's trillions of dollars. It makes it difficult for people to access care that is aligned with their needs, health priorities, and preferences. Unfortunately, it is really centered on the person and delivered with cultural humility, despite the heroic efforts by healthcare professionals. As data is collected and analyzed, we see huge disparities in how healthcare is delivered. And the data highlights the health inequities across our communities. And we've seen this come to light. Many of us have experienced this. We've seen it really come to light over the last couple of years. So PFCC Partners, who are we? We recognize the need to open the space for patients, family caregivers, and community voices to drive the improvements in this complex system. We know that these voices are a key catalyst for improvement in system change. Our team has decades of passionate experience partnering with healthcare systems and leaders engaging those with lived experiences in their efforts to improve. PFCC Partners, here we work to open spaces by creating partnerships that allow improvements. One of the ways that we do that is through our PFA network. The PFA network creates the space and being able to help with that improvement. It's a network made up of patient family advisors for patient family advisors. So it's people using their lived experiences to influence healthcare improvement. The PFA network offers engagement opportunities. It offers community as well as skills development. We have over 800 voices that are a part of this community. We have a unique understanding of the infrastructure, context, and supports needed for impactful engagement. If you are a patient and family advisor or a PFA, we invite you to join our community. And Lindsay, can I ask you to drop that link into the chat? So that's a little bit about PFCC Partners. So excited to introduce our community of practice today. It's entitled Patient, Family, and Professional Partnership through a statewide interdisciplinary quality improvement program. The Florida Department of Health Title V Children and Youth with Special Healthcare Needs program within the Office of Children's Medical Services Programs champions family and youth partnership and leadership through multiple activities. including program collaboration with agencies, health systems, and community organizations. A major initiative in this regard is a 5-year statewide quality improvement learning and action network in partnership with the National Institute for Children's Health Quality. The initiative involves multiple clinical interprofessional quality improvement teams within 7 different statewide networks for access and quality. So there may be a lot of acronyms that get mentioned today. We'll work to continue to say what they mean. I want to briefly introduce our presenters, and they will be able to introduce themselves as only they can. So we have Ms. Johnny Hollis, who is the Florida's Title V Children and Youth with Special Healthcare Needs Director in the Florida Department of Health, as well as the Bureau Chief Director of Clinical Operations. We have Ms. Eliza Williamson, who is an Associate Project Director at the National Institute for Children's Health Quality. At the National Institute for Children's Health Quality, it's a mission-driven nonprofit that drives dramatic and sustainable changes in the complex health issues facing children's health. And last but certainly not least, we have presenter Linda Starnes, who has spent her life actively involved in the disability community as an educator, parent, speaker, and advocate. After working in special education in Tennessee and Texas, and later appointed to positions at the U.S. Department of Justice and Education in D.C., she shifted to her most important role as mother of 2 different rare conditions and complex care needs. With that, I will turn it over to Linda.
Thank you, everybody. It's so great to be here. This is such a wonderful mix for me because of the friends that I know with the PFCC partners, and a lot of my work colleagues are here. And I'm seeing a lot of faces from Florida in general. So this is just a pleasure to be able to be here with you all and bring this group together and have you all meet one another and hear a little bit about public health's involvement with family engagement and family partnership and leadership in a little different way than some of our other conversations. But I want my boss, Johnny Hollis, who's just the best, to kickstart things as we bring up our slides. And then Eliza as well will be being a part of this conversation, and we are excited to be here.
Thank you, Linda. And I just have to say, I'm only as good as my team is. And so I am supported by a wonderful team and appreciate each and every one of you on this call. So greetings and salutations, and welcome to our workshop presentation on collaborative initiatives for transforming family engagement, family partnership, and family leadership, where we will share the why and how we are doing this through our statewide interdisciplinary quality improvement initiative. And if we can go ahead and go on to the next slide. I know early in my career, I was guilty of making assumptions about what our patients and families valued or needed. And I just have to tell you, I'm so relieved to report how satisfying and rewarding it is to have made that paradigm shift with our focus on having patient and family representatives as part of our healthcare teams, actively telling us what they need and participating and weaving their voice into what is planned, designed, and implemented, and especially with what we're going to talk about today with quality improvement efforts. So again, I serve as the Bureau Chief of Specialty Programs, which includes our Title V Children Youth with Special Healthcare Needs Director and overseeing that program under the Office of Children's Medical Services. And again, it's our entire collaborative group that couldn't be here with us today, but that we are thankful to be representing the work that they're doing with our DOH colleagues extraordinaire, including Linda herself.
And as Naomi said, and some of you all know already, I'm Linda Starnes, but and the reason I am in this work is because I'm a mom first and foremost, and I bring that voice of lived experience from over almost 30 years now. My daughter turns 30 next month. But I have had the pleasure and the honor of working in a variety of capacities prior to their coming into the world, and then on boards and committees related to health care and to disability all through the years. And so it's kind of a culmination of work that I'm doing now with our State Department of Health. And Eliza.
Hi, everyone. This is Eliza Williamson. I'm an Associate Project Director at the National Institute for Children's Health Quality, one of our acronyms today. My background is in health psychology and research, but I joined NICHQ in 2019, and I've been lucky to work on one of the initiatives we're going to tell you about today since my start at NICHQ. So it's great to be with you, and I'm excited to share this work. So here's our plan for our time together. We will give an overview of Children's Medical Services, Title V, Children and Youth with Special Healthcare Needs Program, as well as an overview of NICHQ. And then we'll talk about a few initiatives. One, the Florida's Children and Youth with Special Healthcare Needs Quality Improvement Initiative, as well as a few other of the Title V Children and Youth with Special Healthcare Needs initiatives related to our family professional partnerships. And then we will wrap up with a few final thoughts and leave you with some resources that will hopefully be helpful to you, and have time for questions. I'll hand it back to Johnny to get us started.
Thank you, Eliza. Next slide, please. So our first acronym, I'm not sure how many of you are familiar with Title V. For those of you who may not know, it does come from the Social Security Act, and it is a block grant that all states receive for the maternal child health and children with special health care programming. So we wanted to just do a quick overview of our population estimates here in Florida. And according to our national survey of children's health data, in Florida, we have about 4.2 million children and youth, and that's represented by the larger circle on the screen that you see. And of the 4.2, we've recently had a population increase of our children with special health care needs. And so we're now at 19.6%. And that's represented by the lighter blue mid circle on the screen. And our children with special health care needs population represents those with medical, behavioral, or developmental conditions, including things like asthma, ADHD, and about 13,000 other conditions. And it's this population that Title V is responsible for ensuring access to quality child health services, and especially those individuals with low income or limited availability of care and disparities in health equity. And so then within our children with special health care needs population, we have a smaller subset of children and youth with those with complex medical conditions, also known as CMC. And those really represent our children and youth with serious and chronic medical conditions, as evidenced by their involvement with multiple specialists and requiring medical technology, requiring tertiary and higher medical system level of care. And while it only represents about 1% of children, they represent over a third of our healthcare spending and 40% of our deaths. Now, you heard me at the very top talk about our block grant that we receive. And specific for our children with special healthcare needs this year, it's a little under $8 million. So that sounds like a lot, but when we look that we've got over 800,000 children in Florida, that's less than $10 per child. Not much to do with that, right? So overall, managed care has evolved and is now more responsible for those direct care services. Under Title V, we've shifted to looking at more what we can do from a population health perspective for greater impact, including some infrastructure strengthening, as you'll hear us talk about today with our planning and programming, which includes quality improvement. Next slide, please. So our why and our goal here were developed in partnership with our statewide family leaders and other partners that we work with us. Our why is in line with our national outcome measure for children and youth with special health care needs ages 0 through 17, that they receive care in a well-functioning system. Our why embeds those needed core tenets of family-centered, comprehensive, and coordinated care as essential components or ingredients, as you'll hear later, to improve health outcomes and quality of life. In parallel, our overall vision or aim, like other Title V Children and Youth with Special Health Care Needs program, is to support and grow a system of high quality care that serves all children, regardless of insurance, geographic, or other status. We regularly review and refer back to our why and aim statements. And the reason is it really helps to ground us in our planning and our implementation and evaluation of the work. Whenever we talk about our purpose, we also use our aim statement to ensure alignment across our statewide networks for our access and quality, as well as when we're onboarding new partners, including our family leaders. Next slide, please.
Yeah,
Eliza?
so thanks, Johnny. So NICHQ has been fortunate to have a contract with the Florida Department of Health to support the development of one of the initiatives that we'll be telling you about in a moment. But first, I'd like to tell you just a little bit more about NICHQ, the National Institute for Children's Health Quality that I work for, and who we are. So we are a mission-driven nonprofit, and we're based in Boston, but these days we have staff working in a handful of states and funded projects in many more states. So the aim that Johnny just shared is also very aligned with NICHQ's. NICHQ is committed to achieving better health outcomes for children by driving and sustaining improvements. So this has been a really natural and exciting partnership for us. I'm not sure if you're seeing that on the screen, but I hope the slides are back to normal. Our mission and vision are fundamental to who we are and what we're trying to accomplish at NICHQ. So ultimately, what motivates us is the belief that children and families deserve better systems and supports so that every child achieves optimal health. And our work at NICHQ is project-based, so often multi-year projects. And the expertise that we bring to this work is in leading and managing learning collaboratives to improve health outcomes for infants, children, and birthing people. We work to identify and scale best practices in improving children's health using quality improvement methods and tools. And we facilitate cross-sector collaboration and convening of different partners and work to develop measurement strategies and supporting efficient data collection and data management. So much of what we do to support the initiative we'll tell you about in a moment. So we have a diverse portfolio of ongoing projects right now in the areas of equity, infant health, early childhood, special healthcare needs. So I just want to share this here, that details of our projects and other information about NICHQ can be found on our website here. We always welcome new opportunities and partnerships, so I encourage you to reach out if you'd like to learn more. And Johnny, I'll just hand it right back to you.
Thanks, Eliza. Next slide, please. So when we're developing our logic model for our statewide quality improvement initiatives, our long-term outcomes included establishing and integrating programs and partnerships across the state. So for example, we have multiple contracted partners across the state for our children with condition-specific diagnoses such as diabetes, pulmonary, cleft lip, cleft palate, HIV, so on and so forth. And as part of our long-term outcomes, we really hope to join together these previously siloed programs so that they could collaborate in working with other like partners, both on individual and then on a collective statewide quality improvement effort. And that would really help them learn from each other's work and then as subsequently have that collective impact by working all together. And so in our long-term outcome of family-centered and equitable programming, I really like to think about the motto, nothing about us without us, right? And when I think about family-centered and equitable programming, we know it's vital to ensure that we incorporate the very voices of the families that we serve, to ensure that it's their perspective, their need, and that health equity is then driving the planning, implementation, and evaluation of strategies as we're working to increase access to higher quality and access to systems serving all of our children with special health care needs. And so with our overarching goals to improve health outcomes for children, families, and youth with special health care needs and their family, so that ultimately they are safe, healthy, and thriving where they live, learn, and play. Next slide, please. So once we identified our need and our goal, it was time for us to work together to determine the what and the how. So following the Center for Disease Control, or CDC's, public health call to action, we utilized what's called a public health 3.0 framework to engage community stakeholders from both the public and private sectors, so that we were forming vibrant, structured cross-sector partnerships that were designed to develop and guide population health approaches and to really foster shared funding, services, governance, and collective action. So this, if you will, is our illustration that was born under our mental model of what did it look like to have these structured cross-sector partnership. And as the illustration depicts, it really does take a village to come together to help build a bridge to accomplish improved health outcomes for our children and youth with special health care needs. So for example, if you look on this illustration at the bottom in the middle, that far left brown pillar, that's children's medical services. And then if you, and so we're the program that helps offer support to the programming and the use of data or informed decision makings when working on identified needs, which is the other pillar that you see on this bridge. And so then going across the bridge, you can see that family representation has been key to this conceptual design in building that bridge to better health for children with special health care needs. And this also includes elements of education and outreach, which are also provided by our Title V program. And our community partners and healthcare programs are then included in the use of shared, braided, or pooled resources, as collectively together we collaborate on what, with our families driving that voice, we collaborate on what is needed to then improve health outcomes. And that includes promoting best practices as we work to conduct research, design and implement quality improvement projects, and then really develop policy for sustainability with what we're doing. So next slide, please. So projects like this can be very daunting and overwhelming. So it really is an important part of buy-in and change management to include breaking down big conceptual things like this into bite-sized pieces, and then using a stepwise approach with small tests of change, or pilots, if you will. We've often said there's nothing wrong with starting with one. Just start with one and test and see how that goes. It doesn't have to be a whole program that you're testing. You can just test one thing with one person. And so in our planning, we were really intentional to make sure that we had the necessary things, which we call implementation drivers, which are organizational, compensatory, and leadership things as part of implementation, and that our timeline was reflective of lessons we had learned through implementation science, and that we needed to allow ourselves up to full 5 years for full-scale implementation and planning and change over time. Next slide, please. So this is a good illustration of what I was talking about with the condition-specific programs that we have across the state. You'll see in the very middle of that, the illustration depicted by the bright orange circle is our Children's Medical Services Learning and Action Network, which was designed with NICHQ as part of that. And then the outer orange circles represent those 7 condition-specific partnerships that we have that represent over 30 organizational teams across the state that are coming together collaboratively with our family leaders at the table to then establish these integrated partnerships as we focus on the family voice and health equity and the development of local and then statewide quality improvement projects. So this then became our space, if you will, our Learning and Action Network, our space for our teams to come together to work on quality improvement, both within their sites and then across sites with other partners from other areas of the state. And from the beginning, we worked with these teams to make sure we were being intentional and having them incorporate family representation on their teams. And so we are guilty of this partnership of building the plane as we fly it. And so we're constantly learning and doing better as a result of what we're learning. And so this journey, we have used our very iterative quality improvement approach, if you will, as each team is interacting with each other and other teams to learn from what we did right or the challenges when what we had hoped didn't work out, and then applying those lessons learned moving forward. So not only are our teams doing that, we ourselves, we're trying to organize the team, are also learning by quality improvement methods. And so again, our goal during this whole journey is to make sure that we are supporting our families and our team members to be champions for quality improvement in what they're doing and working for better outcomes and for our children and youth with special health care needs. Next slide, please.
So it's going to move now to me and to tell you a little bit about the family engagement side. And Libby Hoy, I'm giving you a shout out because long before I ever knew you, this was probably 10 years ago, I had come up with an analogy to explain some of my experiences that I was having on the healthcare side and being involved in some committee work. And I used the analogy of a cake. And so I knew we had to be friends once I saw that cake of yours with the funfetti. But my analogy was that I had been invited in, purposely so, to bring the voice of lived experience into a large conversation on strategic planning with a large hospital system. And thought I would be there more towards the beginning based on what I was given initially. And lo and behold, they presented their strategic plan after it was all said and done and said, what do you think? So I've told people it's like I wasn't invited to help pick out the recipe and get the ingredients and stir up the batter and bake and ice a cake. I was just simply given a slice of the cake and said, don't you think this tastes really good? And so, however, I'm not always a chocolate cake person. I think if I had been in there in the beginning, I would have picked a recipe for coconut cake, and it would have been a whole different batter and coconut sprinkled in and around. So that's a similar kind of analogy that we use with the PFCC partners, that we need to be baked in from the beginning and get to be a part of the process, which is what I know Title V has very much, ever since my involvement, has very much strived to do. And then, everybody's in a different place on this whole thought of family engagement. And so we're trying to meet these different teams where they are and bring them along in the aspect of inclusion of patient and family partners on their local quality improvement team. Next slide. Eliza, I'm gonna let you kickstart this and I'll finish it up.
Great. So we wanted to share a bit of our journey as we've taken steps towards building these partnerships with family partners in this Learning and Action Network. So first, we did some information gathering. We sent out a survey and talked to our participants at the different institutional and local hospital teams to hear what is or isn't working for them when it comes to engaging family partners, to learn techniques from those who are already working with family partners, what's going well for them, to really understand sort of baseline what's going on with this group and where we can provide support. So this step was all about getting a better understanding of where our teams are coming from and what support is needed. Next, resources. What we learned is that many of our teams needed guidance and a place to start. So as a result of this survey and information gathering, talking to teams, we developed a few resources that we felt were missing. These were resources not only to support recruiting and welcoming a family partner to their team, but also a roadmap resource to really carry the team and the family partner throughout the relationship and thinking about how to sustain the partnership as well. So Linda's going to share about that in a bit. And then next, consistency, consistently highlighting the work of family partners and importance of family partnerships with this larger learning and action network. So during meetings with the entire learning and action network together, we're intentional to continue to share strategies to grow partnerships with families and to hear from our family partners about the quality improvement work that they're involved in. And really just being intentional to keep family leadership front and center.
And I had the pleasure of being involved. I've been joined at the hip practically with Eliza throughout all of this because we worked together on that information gathering and the survey that got put together to be sent out to everybody. We worked together on developing the different resources so that, and there were other voices involved as well. And then, you know, I've had the pleasure of speaking to our entire land, which is a nice, healthy group of folks when you get them all together, and then also supporting and encouraging some of the other family partners to be a part of the presentations as well. And now what we're doing, we started last year and have an even more intentional focus of having some time set aside just for the family partners that are involved, and some focused meetings for them to talk through if they've got added questions about what they're learning in quality improvement, because many of them are not coming from the healthcare side of life. They're coming with other academic and work backgrounds, and they're there because of a loved one or themselves, and being involved through the lived experience process. So we've had some really great meetings, and we are going to be having a whole series throughout the rest of the time that the LAN is active. Next slide.
Yeah, so
numbers, Eliza, share that.
yeah, absolutely. So our progress with building family partnerships and with this network can be measured both quantitatively and qualitatively, of course. So our progress by the numbers is shown here on the graph. In 2019, when we first started honing in on this work and looking specifically at this metric, you'll see that we had 3 family partners across our 30 plus hospital quality improvement teams. And now 3 years plus into the project, we have grown this group of family partners to 17 members and counting. This is an important metric for us because our goal and the expectation shared with our participants is that every team will have a family partner involved and contributing actively to the quality improvement project. So 100% is really the goal. I do want to note that it's important for us to see progress by the numbers, but we know that headcount isn't the whole story. So we're actively following how the family partners are engaged in quality improvement projects. And I'm going to hand it back to Linda to share a little bit more about some of our family partners and the impact we've seen.
So I've mentioned, that we are now intentional and focused on the a little deeper support, because quality improvement is quite heady stuff. And if you've never been involved, there is a lot to learn. But it actually is also very palatable once you start to be brought into it. And so these are just a couple of the family partners. Jill Hill is up at the top. And she works professionally as a family leader in the organization she's in, but she also wears the hat of just being the lived experience voice on their quality improvement team. And I'm going to let you hear a little bit more from Jill.
It's all about advocating for children and families to make sure that they get the services they desperately need in a timely manner without so much confusion.
And so that she is there to help that QI team that she's a part of to kind of keep focused on that heart of the issue. As many of our family partners, that's one of the things that they bring each time. Angela Miney in the middle, the woman with the shorter gray hair, she's a good friend, and she is a nationally honored family partner as well. And she is a part of one of the quality improvement teams in our state too.
It is only by working together that we will bring about real systems change for our children and youth with special healthcare needs. Families need to be part of the conversation and the work.
And then finally, Dr. Valerie, I'm going to go with Dr. V. She is one of the champions for family partnerships. She works beautifully with and including and bringing in that family voice in the quality improvement project she's a part of. And we don't have a clip for her, so I'm going to read it for you all. She says, patients and families are essential to what we do in moving forward with quality and safety. Our family partner is really involved with all our teams and gives us input and is really an important part of us. Next slide. So one of the other items that was mentioned in a previous slide and a resource that we put together was a roadmap, because one of our meetings early on, one of the professional sides folks said, if we just had a roadmap for how to do this stuff, if we could just have a roadmap. And so I took that to heart and I drafted a roadmap, and then we worked together as a team to finalize it. And it's been out for about a year now and has gotten some national recognition, and it's public. It's there. Grab the QR code if you want. We'll also have a link later for it as well. But it was for our land, but it can actually speak even beyond just quality improvement. It gives the information just on all of those things that we know on the family and patient side that are the good practices for inviting in and including the voice of family and patient partners. Next slide. And this is just a quick snapshot of the roadmap, and each of those elements that are on the roadmap, we have a devoted content to each one of the steps along the journey, and links in the roadmap as well that are of course acknowledged for the organizations that where we admired and acquired Libby Hoy along with Stealing Shamelessly, and PFCCpartners is one of the organizations that we point out as saying that they are a group of excellence to look towards for further information on the work of patient and family partners. Next slide. And so we have some other Title V initiatives, and Johnny, I'm going to let you kickstart this.
Yes, thank you. Next slide, please. So you've heard that family engagement to us is very important at all levels. And so this includes paid family leader positions at the regional level, and they help emphasize the need for family centeredness with community providers and partners, and really help to work to engage other families and family organizations, and then help assist with planning, implementation, and evaluation at that community level. And then at the state level, we also have our paid leader position. And again, we're very fortunate and grateful to have Linda Starnes at the helm for us, because not only is she deeply involved in planning, implementation, evaluation at the state level, but she also networks with other family, disability, and children with special healthcare needs at the local, state, and national level. And then she's able to bring that information, those best practices, those lessons learned to really help us then infuse our program's design and evaluation. All right, next slide, please. In Florida, we've got, just like the whole nation, especially after COVID, we really are just seeing an explosion of already a priority need for children to have access to appropriate mental behavioral health treatment. So as part of what we're doing under Title V, we're developing integrated behavioral health hubs. And so again, this is partnerships with university or tertiary care systems. And the behavioral health hub has a pediatric mental health care access team. So a child and adolescent psychiatrist, care coordinations, clinicians that then help provide care coordination and resource linkage, skill building training, and if needed, psychiatric teleconsultation services. And so those behavioral health hubs partner with our primary care providers in the community to help build their skills to better screen, manage, and treat children with common behavioral health conditions. And so it was actually a family and youth voice that really drove this priority need as part of our Title V needs assessment. And then family voice was also used in the design planning for the original conception of this model. And so it's been included with additional community family focus groups, especially in those areas that we're developing new models, and then as well as the planning, implementation, and ongoing evaluation. We are so lucky in Florida to be blessed with several different family-driven organizations, and that they've really helped us part of this project. And that includes our regional family affiliates from NAMI, the National Alliance on Mental Illness, NAMI, and also our Family to Family Health Information Center here in Florida, which is the Family Network Disabilities, or FND. Next slide, please.
Another organization is our Florida Family Leaders Network. And this is a group that's been around since 2017, I'm thinking. The timeline is coming up. But it's a concept, actually, that Angela Miney was in a meeting with Johnny Hollis and said, you know, I wish there was a way for the family leaders in our state to just know that one another exists and get together and have an opportunity to network a little bit more and strengthen some of the possible collaborations we might have. And from that conversation, Title V has a contractual relationship with the University of Florida's Pediatric Pulmonary Center. That's hard to say sometimes. And it so happens that's where Angela Miney works as a family partner with that PPC. And so they hold the contract for developing and sustaining the Florida Family Leaders Network. And again, it's to try to break down those silos, not only from, across the state and our very different geography all across the state, but also with all of the different organizations that touch the lives of children and youth with special health care needs. And to also welcome in champions. It's not just for the lived experience voice, but it's for those champions who also are part of the process of breaking down those silos and bringing in the voice of lived experience. And of course, our young people, and then emerging professionals are involved as well. Those who are in public health related and or medical related, or any area that might be of interest. We have college and graduate students who are involved as well. And you can see our email address, or our website address is floridaleaders.org. Next slide. And just very quickly, you can see it's 2016. We've had a lot of growth, and we focus on having ongoing private Facebook webs where we share a lot, but then we also have a public listserv that shares a lot of information as well. Then we have an annual summit, and that summit is free for those of us in Florida. If you want to come in from out of state, we welcome you. We just can't cover your costs, but we would love to have you. And then we also have a spring webinar series. And I'll say one of our friends from the PFCC was at our conference and spoke. Deneen, I don't know if Deneen's here today. I haven't had a chance to check, but Deneen Green and she did a fabulous job. So we were so thrilled to have her. And because of you all, we know of Deneen. So anyway, we'll let you know about the summit in September 2023 as well when we start planning. Next slide. Another collaboration that we have, and then I'm going to mention this is it's not just Title V, but we have every state has an adolescent health office, and that's another potential partner. You never know where your partnerships for collaboration might come. And for us, it was interagency. This is the first product, so to speak, in a collaboration that we're going to continue forward with. Again, if you want to capture that QR code, and this is just a simple card that is catchy enough, we hope, to catch the attention of our young people as they're thinking about transition in their future. And the QR code takes them to a website under the adolescent health section of our Florida Department of Health. And it has all kinds of information regarding transition, not just healthcare transition, but a lot of things to think about regarding transition, because it's for all kids. And then also for the trusted adults in their life, that could be a support for them as well as they work with their young people on transition. Next up. So now our final thoughts. The multidisciplinary team opportunities, that's the best kind of collaboration when you have all these different perspectives around and really sifting through the issues that you might have in front of you. But we've learned a little bit along the way on that, and everyone is in a different place. And that's an opportunity. And so we just do strive to meet people where they are, and specifically for this conversation, where they are, and welcoming in patients and families into the quality improvement circle.
Yes, and then one of our other final thoughts is it takes time. And this one's really hard for me because I used to say a Rome wasn't built in a day because I didn't build it. But you heard me earlier say that there is this science to anytime you implement something, and anything from planning to a full-scale implementation with something like this can be upwards of 5 years. And so this includes taking those baby steps and using a stepwise approach, making sure, again, that you've got all the things necessary as part of implementing. And that can be small tests of change. You can start with just one, but then continuing to use that iterative quality improvement methodology to then better replicate and then build out and have full-scale implementation over time. So again, it's important to, as part of taking time, let's make sure we're being adaptive with a growth mindset and being curious in what we can learn and being open to that learning and other people's perspective as part of what we need to be thinking about in implementation. And then we also have to be ready for differing takes on inclusion, especially inclusion of our parent family partnerships, our professional family partnership, excuse me. As part of that challenge, we have to be ready for dissent. And a really good example of this is when we were really starting to open up that conversation and encouraging all the snacks to make sure they had, family representation on that. We've got some differing opinions on whether that was, encouraging of payment for their time and expertise versus using them in a volunteering capacity. So again, wherever you can, while we want to take on differing takes and opinions, and part of that, when you can and decisions been made, make sure you're setting clear expectation and then reinforcing that often.
And I'll just wrap us up here with our last two final thoughts. Be aware of tokenism and checking the box. I think this is something that is always on our minds as we do this work, and goes right back to Linda and Libby's and everyone's cake analogy. So therefore, we've learned to build trust through openness and inclusive language and being intentional in this way. And it's been important to us to create a space that allows for family leaders to thrive and feel empowered to share their expertise. And finally, recruiting and retaining diverse participants. So we need to be reflective of our community in full, and that takes time. Today, we shared a lot of the strategies that we have tested to both recruit and retain family partners. And so for us so far, that has included providing support, creating resources to ensure family leaders have everything they need to be a full member of the team, and also train the local teams on how to recruit and retain diverse partners as well. So in case you did not capture our resources along the way, I'll put up these final QR codes. But I'm also on the next slide going to share our links from the different initiatives and different resources that we have shared along the way today. So you can click on those and read into them and dig into them more fully if you're interested.
Yeah, and while we're giving people time to look at the QR codes and then get the links, and I believe these slides, if you don't already have them, are coming to you. So you've heard from us, and we wanted to end a little bit early so we could hear more from you. So I'm sorry we went over a little bit, but if you have any questions or comments, we'd love to hear from you. Please put in the chat box or come off of mute if you can. Even if you want to share, what you might be involved in as part of quality improvement initiatives in your area of work, and if they are including patient and family partnerships, where are some of the things that you guys are at with your journey? We've talked about family partnerships. Youth voice is very important to us as part of this too. So love to hear what you guys are doing or hearing or experiencing with, engagement of family and youth voice in other areas. Any questions or comments? You can put them in the chat or come off of mute.
While we're waiting for others to come off mute, I'll start us off. I do have a quick question for you. As Linda had mentioned at the very beginning, if there were participants that serve adults, how this information is still beneficial because children become adults. So how are you that partnership? Are you working in that arena yet, or how are you seeing that collaboration, or do you have thoughts of how to move that work forward?
Do you want me to start, Linda, or do you want to start?
You're muted, Linda.
I will say that I put that in there because I know a lot of the folks involved in this organization that we're presenting to, they do more focus on the adult level and the PFACs that they're working on, but that these young people that we're talking about, more and more they are growing up and moving into full adulthood, and they're going to be utilizing those hospital services, and they need all of what we've been talking about with PFCC partners and all of the improvements in those adult health systems. It's going to help these young people as they move in, because they're going to be utilizing those hospital services and health services. But Johnny, you can go ahead and take the other side of that question.
Yeah, well, sort of the work that we're doing is actually came out of the Family Florida Leader Network, FFLN, and that some of the parents were bringing their youth to that as well. And so we were like, well, what are we doing to help support our youth? Because part of the FFLN is, and that education is also giving back to our parents, right? And so we want to help our youth with advocacy, resiliency, those types of things, and give back to them as well. So we're looking at at what does that look like on the Family Florida Leader Network to have a youth track. We are partnering with Family Cafe which is another family-run disability organization in Florida that puts on a big family disability conference every year. And so we're specifically building out a youth track this year that's focusing on well-being, and part of well-being, self-advocacy, resiliency, and things like that. And I just had another wonderful call here with our one of our transition experts in Florida with Jack's Hats and Dr. Rita Nathawad. And that's one of our dreams and vision, is to really build that state youth transition resource center, if you will, to really help our youth as they enter into the adult realm, because we know that's really where we're struggling with, is making sure that we have adult care providers that they can access and follow up with them with the quality that they need, that they and the environment that they need to, again, be thriving and doing well. We know our pediatrics loves and hugs and nurtures, and then it can be just a huge culture shock for our growing young adults, especially as they enter into that adult healthcare system. So we're looking at some of that, and that also includes system mapping with where are our resources for adults, system needs for our youth that are transitioning, and so that we can also be then looking at the gaps and where we can go. But part of what we're going to be doing at the Family Cafe, I'm hoping, is doing another needs assessment. What's working, what's not working, and then let's start planning what this resource center looks like for them moving forward.
And Naomi, I will mention that a few of the teams that are part of the quality improvement initiative that we've got going on focus specifically on a quality improvement project related to healthcare transition. So that's uppermost in a lot of those teams' minds, or health literacy, which that's, you know, just hand in hand with healthcare transition.
Wonderful, thank you. There was another question, a question in the chat. It says, what was the most surprising thing you discovered in your QI process with your partnerships?
That's a good question.
Yeah, and I'm going to say the synergy and the impact. I had no idea the synergy and the impact when these teams came together, and then what they were doing. I mean, we've had websites developed that then school nurses can access for education. Our HIV team in this year is coming up with, not only are they going to be implementing a social determinants of health screener, but looking at food insecurity. So talk about really embracing all aspects of health and wellness in life, and not just focusing on that medical as part of a quality improvement. And what does that look like to be looking at, you know, within a tertiary center focusing on HIV, that we're screening for food insecurity and helping them get plugged into the resources they need to address that synergy, that collective impact.
Eliza, what about you on the surprise side? I'm just curious.
Yeah, I don't know if this is a surprise, but I don't think it's a surprise, but I just want to recognize, you know, I think quality improvement sometimes feels like it's a very technical term and maybe like a scary field to dig into. But QI is all about digging into the systems and processes and testing small and learning quickly. And I think that it's really just over and over, we've seen when family partners are involved in the QI projects, it's the families who see the smaller pieces of the system and understand the barriers and can offer the change ideas that the teams can test that will lead to improvement. So I think it's been great and not surprising, but great to see that over and over, and just these really creative ideas coming through.
We families have to be creative. The lives that we live and every day is so different and can change on a dime. And if you don't have a little creativity to bring to bear to make it all work, you know, you struggle a bit. So that's where I see Debbie, my friend Debbie, her thumb is up on that one.
Thank you all so much. You know, we are coming at time. I do want to bring Libby Hoy in so she can have some closing remarks. Thank you all.
Absolutely. What a great presentation of what's possible when we really embed the patient family perspective into our quality improvement work. I really appreciate all of our presenters today. And Linda, you give me far too much credit, but I so appreciate the shout out and I so appreciate our partnership. And that's what this is all about, right? We're all learning about this together. It's a team sport. There's no competition when it comes to patient family engagement or patient safety. And so I just wanted to jump in really quickly and say thank you very much. Linda, you guys have shared quite a bit about how the patient family partners in Florida have several opportunities to connect. And for those of you who are outside Florida and may not be able to necessarily access that, I just wanted to mention that the PFA network is available to you. It's a national organization. We don't have any, there's no membership fee, there's no membership commitment. It's just come and get what you need, get what you want. And one of the requests we had from the community recently was to develop a pediatric specific page on our online forum. So I just wanted to put in.
You muted yourself, Libby.
Just lost you.
That's because I muted myself instead of putting it in the chat. Silly girl. That form is there. That's a place that you can ask questions. You'll see many other topic areas, many other interest groups. There's a group on quality improvement and how we engage patients and families in quality improvement. So I really encourage you to continue this conversation. Let's look to this team from Florida as a real example of what can happen when we come together, we share our best practices, we share our experiences and our failures, fail forward, right? I've always wanted to start Failure University, FU, but it didn't fly with our board. Anyway, I digress. But sharing, the more we share, the more authentic we are, the more transparent we are, the more we all move this ball forward. So just wanted to jump in and say thank you so much for your presentation today and to everyone for joining us. And Jamie, that is such a great question. That was awesome. All right. Naomi, it's all yours to close us out.
Okay, thank you all again so much. We hope that you have a wonderful weekend. If anyone is on the call and you have a project that you've been working on or would like to bring your, what Libby just mentioned, your successes or ahas, learned failures, please reach out to us. We'd love to incorporate you into one of our community of practice in 2023. So with that, I think you all be safe and have a wonderful holiday season.
Thank you.
Bye.
Thank you all. Bye.
Happy holidays, everybody.
Come on.